It's time for your healthy dose of information, sponsored by Hannibal Regional Hospital, Hannibal Regional Medical Group. And from the medical group this morning, we've got Dr. Ed Cline. Good morning, Dr. Cline.
Good morning. How are you?
I'm very good. How are you?
Oh, good.
It's good to have you here this morning.
Thank you. Thank you for having us.
Thanks for coming in. I'm glad that the weather is good for you today. We've had a few times this winter when we do the Healthy Dose segment here, and you folks are always so great to come in for the segment, but it's been a little tough at times. So you got a nice morning to come in.
Well, I'll take all the luck I can get.
That's good. And you're helping people do better with their feet, do better with their shoes, and as a podiatrist, you offer them a whole lot of options to be successful with walking and really with their whole body, because it all relates, doesn't it? From your feet on up.
It does. To be able to maintain a strong foundation with appropriate shoes and shoe choices for the activities, and then maintain the health of your foot, protect it from the environment, certainly from our cold temperatures and our icy roadways and sidewalks, and then as people transition from running on the treadmill inside to getting out and getting some fresh air, they need to take care of their feet and their shoes and make sure that they're safe as well.
Yeah, that's a really good point. So tell us, as a podiatrist, what do you do?
Well, a podiatrist is a doctor who treats the foot from the end of the toe to the top of the ankle, from the skin to the bones, ligaments, muscles, nerves, tendons. We treat injuries, diseases, and illness of the foot.
All things foot.
All things foot.
All right. And how long have you been in practice?
I've been in practice for 17 years in Hannibal. I practiced briefly in St. Louis prior to moving to Hannibal, but Hannibal's now been our home for 17 years.
Good. And what type of patients do you see? What's your average patient?
Oh, my goodness. We see just about everybody. Grandmas and grandpas, babies, children, moms and dads, brothers and sisters. We take it all.
What does a podiatrist do? I know that you talked a little bit about that, but is the only healthcare professional whose total training focuses on the foot?
That's correct.
Okay.
So the podiatrist, someone like myself, will manage diseases of the body that manifest themselves in the foot,
okay.
Whether with medication, conservative treatment, sometimes surgical treatment. We kind of cover the gamut as far as that's concerned.
Okay, and you offer a whole range of podiatric services at Hannibal Regional Medical Group.
We do. From shoe gear recommendations, we're not a shoe store. We don't sell shoes, but we do make recommendations for appropriate types. We will, in certain disease cases, we'll recommend prescription shoes, or custom-made shoes or insoles for the patient that needs that sort of support or protection. And that could be someone with diabetes or nerve damage that needs the appropriate support to protect their foot and give them that stable base to operate on.
Okay, shoes are a very, very important thing, right?
Oh, absolutely. The only protection you have from the environment to your feet, you only have 2 feet. Mm-hmm. And if you don't protect them, you don't get to keep them and use them.
And it matters how your feet roll when you walk or run or whatever exercise you do. That all relates to the overall alignment of your body.
It absolutely can. The shoe can, in providing that stable platform, the shoe can allow you to strike at your heel, roll to the ball of your foot, and then propel forward in the most functional way possible to prevent injury, but also to increase function and stability. And
you mentioned shoes, but socks are important too.
Oh, absolutely. It's important to wear a sock with your shoes. Many times it's a fashion statement to wear shoes without socks, but you're not protecting your foot, not helping yourself in that way. Socks that are made to wick the moisture away from your foot will prevent blisters and irritations. One of the more common complaints that we see is people come in complaining of an odor in their foot that they just can't get rid of, or their shoes that just won't go away. Most of the time it's teenagers, and that they come home and throw their parents know when they're home because their shoes are off and they can smell them on the other side of the house.
Yeah.
So we try to treat that sometimes with antiperspirants, some other medications, topically applied, sometimes treating the shoe, and in some cases treating it orally with medication as well.
Okay, so there's a lot of options, but the thing is, making sure that you wear the socks and making sure you have the good shoes. Does it help for somebody to bring an old pair of shoes to you? Are you able to look at that and be able to tell from the wear on their shoes what they may need done?
You can, actually. You can look at what we would consider to be a normal tread pattern. You can look at the wear on the bottom of the sole of the shoe to see if they're wearing off the back of the heel on one side or the other. That may indicate some instability in the foot or in the arch. Even more basic than that, you can tell if they're keeping and wearing their shoes for too long. We have a tendency to buy a pair of shoes and wear them for their intended function, and then when they're worn out and we're not going to wear them for that function anymore, we put them in the garage and we use them to cut the grass, or we use them to shovel the yard, or the driveway. But when you're done with that pair of shoes, you need to be done, and protect your foot and use appropriate shoe gear.
Okay, so know when to get rid of a pair of shoes and move on to another pair.
That's correct.
A new pair. Tell us about foot type, because that's something that's really important. Are a lot of people aware of their foot type?
People like yourself probably are.
Yeah.
Runners, active athletes are aware of whether they're an overpronator or an underpronator, or they have a neutral foot. And athletic shoes and running shoes in particular are made and designed just for those specific foot types, whether you're someone who overpronates, which means that you have a flat foot or a flatter foot. Someone who underpronates, they might have a high arched foot. And then the neutral foot, sort of that average in the middle foot that doesn't need excessive support, but does still need protection and doesn't need to be just sort of flopping around free.
Yeah. But these things really do matter.
Absolutely, they do. If you put someone who is a flat-footed overpronator in a underpronating shoe or a neutral shoe, they won't have the support. They'll develop foot pain, they'll develop knee pain, hip pain, even back pain, and that will limit their ability to continue their exercise program. And the worst thing you can do to a runner is tell them you can't run anymore.
Yeah, that's a tough thing to live with.
Yep.
And I know a lot of folks say, I was running, but then my feet were hurting, my shins were hurting, and a lot of times it just has to do with knowing your foot type and getting the right shoe.
That's absolutely correct, and we can diagnose that in the office and make recommendations. I don't like to recommend shoe brands. I don't own a shoe company, but I can certainly recommend a shoe type and help the patient know what to look for, so they're not just going and buying the coolest looking or the prettiest pair of shoes. They buy the right pair.
What's going to be right for you.
Exactly.
Yeah, and then how do you tell when a pair of shoes is worn out? Is it a mileage thing? Like for me as a runner, I know how many miles I've run in a shoe, but you can tell too by looking at maybe the shoe itself, the plastic on the sides, if it's worn.
Certainly you'll evaluate the overall appearance of the shoe. If your toes are torn through the mesh on the top of the shoe, if the sole plate is worn away where you're slick or skimmed off, you don't have that tread pattern that the shoe had when you first bought it. If the rubber or plastic layers on the bottom of the shoe have begun to separate, those shoes are done, and you need to find a new pair.
Okay, so you're going to get a new pair. What are some quick tips for buying exercise shoes?
It's got to fit right. It's got to feel right. It really doesn't matter how it looks. It has to be the right one. It has to be the right shoe for you. You have to look for the sole plate or the pattern on the bottom of the shoe. Will kind of tell the educated shoe consumer, okay, this is a shoe for more support or less support or neutral. And typically, if you look at the bottom of the shoe, from the heel to the toe, if there's a solid tread plate there, that's more of a supportive shoe for an overpronator or a flatter foot patient. Sometimes you look at the bottom of a running shoe and there's a heel strike area, and then there's not much in the arch. Mm-hmm. And then there's an area to strike at the ball of the foot and to push off. And those are from the more high arched or supinating foot types.
Okay. Yeah, those are the ones I don't use.
Right.
Yeah.
Good for you.
Springtime offers us a chance to exercise outside, to get outside. But the thing is, not only should you have good shoes when you're exercising, but you should also have good shoes when you're not necessarily exercising, like sandals and things like that you're also getting something quality there, right?
Boy, that's a hard sell, isn't it? Telling people not to wear flip-flops.
Yeah.
Yeah.
Well, can you get good flip-flops? I mean, excuse me, like you say, you don't want to name brands, but
Right.
I mean, they're on the market, right?
Sure, there are flip-flops or sandals that have arch support in them. There are some that have even a memory foam sole to them. But the important part is to find a shoe or a sandal that will protect your foot from the environment. So if you have a disease process, let's say diabetes, where you don't have the nerves or the sensation in your feet to be able to tell, look, I've stepped on something. It's stuck in my foot or in my shoe. That hurts. I should probably sit down, look at it, remove it, and figure out what's wrong. That patient can't feel that. So they may walk with a thorn stuck in their foot or a piece of glass. Of course, we've seen things like bottle caps and insulin needles and all sorts of things like that. Those are not the right patients to be going out and looking for sandals. They need more protective shoes. But the otherwise uncomplicated patient can typically find a good supportive sandal that's got straps around it, maybe to hold it on the foot. But you don't want to forget that you do get what you pay for. So if you buy a $4.99 pair of flip-flops, you're going to get about $4.99
That's
out
what
of
you
it.
get. Absolutely. Well, and two, if you have foot pain, heel pain, it could be a heel spur, it could be plantar fasciitis. It's something that folks need to come see you about.
Absolutely.
You've got another note here. Important to look at your feet daily and moisturize them.
Absolutely, especially this time of year. If Whitney were still here, we could talk about the amount of humidity in the air and how dry the environment is. But
That's true.
It's with no moisture in the air, it just sucks all the moisture out of our skin. So people will have dry and flaky skin. They may feel itchy and scratchy all winter long. Their feet are really susceptible to that too. But the problem is we don't look at our feet very often. They're in our shoes and our socks. It's so cold out, we don't take those things off, so they're protected. And but they're protected, but they're invisible to us because we can't see them. So you need to take those shoes and socks off on a daily basis. Look for things like dried, cracked skin or calluses that have built up, or a crack between a toe that could get infected. All of those things, those daily inspections are a way to maintain your foot health so you don't miss out on your exercise regimen because you've developed an injury or an illness that has debilitated you.
And the end result being happy feet and a much happier you.
Absolutely.
All right. And folks can come and see you. They can call you at 573-629-3500 at Hannibal Regional Medical Group, right?
That's correct, on the campus of Hannibal Regional Hospital.
All right. Dr. Ed Cline, we appreciate your time. Thanks for coming in.
Thank you for having us.
All right. Travel safe this weekend.
We will.
We'll get to that forecast here in just a bit and let everybody know what to expect. But in the meantime, with your healthy dose of information, it's Hannibal Regional Hospital, Hannibal Regional Medical Group. You can go to hrhonline.org. Again, you can check in with Dr. Cline, podiatrist at Hannibal Regional Medical Group, 573-629-3500. Dr. Cline, thank you. Have a great day, sir.
Thank you.